And in the last, 35 years, have you seen your field changing in a radical way and approaching people and their issues from various angles?
Oh, I have. It's something I talk about a lot when I started practicing, and it goes back over 40 years, but 35 in private practice. When people would come in the office, back in the 1980s, maybe 5% of them were on medicine. And now when they come in, it's closer to 65 or 70% that are on medicine. So I've seen it evolve into a pharmaceutical plan in order to deal with these things first. People want to go real fast, and they want to they want to solve their problems very quickly, instant gratification on those. So we used to work a lot without medication, and I still do whenever I can, but they're coming in with it now.
Yes, and as far as I know, there are institutes, medical institutes out there, and research institutes looking at controlled psilocybin treatments, and the results are quite amazing, especially with PTSD people, soldiers, and guys who spend some of their life in the army, and they are healed in 2, 3, 4 sessions sometimes.
Yeah, what's happening is, and it's really in its research stages. People are jumping on that bandwagon, but we really need to slow the movement down a little bit and be a little bit more controlled with what we do. But we're finding that those hallucinogenic substances are getting to the brain centers that are being injured with PTSD, and they're helping people work their way through it. They're calming the anxiety and the depression down, and they're giving people an easier way to deal with things that, as in the service, where things, they've seen people die in front of them, things they come home with that they just can't face. They're able to work through those. The important component to that is that they're not just giving them the hallucinogens and then that's it. There's a whole counseling program that goes with that, and that's the important part. That we want to make sure people understand, and we want to make sure people understand that that needs to be done in controlled circumstances by someone with an expertise in that area.
Exactly. And through this process, I think another facet of using, as you said, this type of treatment is being revealed that is not an addictive treatment. You are done with it for as long as you need it. As I said, 2, 3, 4 sessions, maybe a little bit more, but there is no addiction involved in this process. You are free to go and live your life. But on the other side, on the chemical plan, you are hooked for the rest of your life.
And that's the problem. The drugs that are being administered don't have the strong addictive properties. However, it's back to an individual component. How much of an addictive person am I? There's some people that will experience that and say, "My God, that was wonderful, and I felt so good." And some of those people are going to leave those settings and they're going to experiment just a little bit more, because the human mind, I always say, is expansive. It doesn't just stop with what we give it. It says, "Oh, well, what if I do this now?" So there's always that danger with some of those folks that they may go out and experiment just a little bit.
Yes, and you spend a lot of time in prisons and nursing homes and substance abuse centers. So, do you think that this type of treatment should now be inclusive of these facilities as well, and go deeper, especially prison, which is a very dangerous environment? And from my experience, not because I was there, from what I read and what I watched and listened to others, it's not an environment that will really change you to the good, to the best. It's the other way around.
Often, people ask that a lot. They'll say, "Well, the hallucinogens, that's terrible. We shouldn't be using, quote, street drugs to treat people." And I say, well, the pharmaceutical industry is loaded with medications that we know are harmful to people. When you see their ads, they give you this string of so-called side effects, which you and I both know are not side effects, they're bad effects. And they're there, and they're looking at the hallucinogens, and we're not seeing those So can we use those? Can we begin to expand on the therapeutic approach? Yes, once we have more research to deal with that, because we're dealing with it enough to know that it works with selective populations. Now we want to be able to see, two things: the what we call latitudinal studies, the short studies where we can say, all right, it's working, but the next step is longitudinal studies over 10 years. Are there going to be any long-term effects with hallucinogens? For some people, there can be some bad trips, so to speak, some things that are problematic. Normally, they can see that in the research phase, but we want to make sure that what we're doing is going to be used on the right populations, the right way, and by the right people. That's the other part of it. It's not just a pill that the doc hands out. This is going to put you in a different neurological state quickly. So we want to have someone there that helps you manage that properly.